All right, well, thank you for tuning into this panel, Public Trust and the Role of Journalists. We'll be exploring questions and themes such as how public trust has been affected by news coverage, scientific uncertainty, and public health messaging. The pandemic has put public trust in institutions under the spotlight, and this panel will be exploring some of those challenges and opportunities. Our speakers include Vera Etches, Jamie Poisson, Christopher Waddell, and Carey Wu, who I'll be introducing in just a moment. They'll each be providing some opening remarks, and then we'll have time afterwards for questions and discussion. We have a very interesting mix of backgrounds and experience here, including journalism, public health, and research. Vera Etches has been the Medical Officer of Health of the City of Ottawa since April 2018. As head of Ottawa Public Health, Dr. Etches has led the capital's response to the COVID-19 pandemic. She previously served as Deputy MOH. Dr. Etches is also an adjunct professor at the University of Ottawa, where she supervises medical residents in the public health and preventive medicine and family medicine. Christopher Waddell is the former director of the School of Journalism and Communication at Carleton University. He led the university's inaugural chair in business journalism and was the founding director of its Bachelor of Media Production and Design program. He joined Carleton after 10 years at CBC Television News, where he was senior program producer for The National and, from 1993 to 2001, parliamentary bureau chief. He's the principal investigator for a planned study on how different generations of Canadians get their news, their health news specifically, during the pandemic. Carey Wu is a professor of sociology at York University. His research focuses on political culture, immigration, and inequality. He often shares his research with the public via national and international TV, radio, and newspaper forums, including NPR, CBC, Toronto Star, Maclean's, Financial Times, and The Conversation. Jamie Poisson is the host of daily CBC News podcast Frontburner. She previously spent 8 years as a reporter with the Toronto Star. She's been nominated for National Newspaper Awards and was part of a team that won the Governor General's Missioner Award for reporting on former Toronto Mayor Rob Ford. She's also won the Sidney Hillman Award for Public Service Journalism twice for investigations into sexual assault on university campuses and ongoing mercury poisoning in Grassy Narrows First Nation. I'm Scott Mitchell. I'm the moderator for this panel. I'm an instructor and PhD candidate with Carleton University. My research includes public communication of science and risk communication, and I'm a knowledge broker with the Canadian Centre on Substance Use and Addiction. Vera's going to start us off with her presentation. Vera, thanks for being with us here today.
Thank you so much. It certainly is the case that trust in public health officials and the information that we provide is essential for public uptake of the preventive measures we need to control transmission of COVID-19. We know that individual behavior change is critical. There's no testing and tracing system that's going to keep this pandemic under control. And so to earn the public's trust, Ottawa Public Health that I lead is aiming to be timely and transparent. My role as a medical officer of health is to make sure that residents have the information they need to make informed choices to keep themselves, their loved ones, and the community safe. And we really rely on media partners to help shape our message and share our message. The media partners have been integral. Effective communication is one of our best tools, and journalists are effective communicators. So here in Ottawa, I feel they've been asking the right questions. They've been fair, they've been thorough, and they are helping get stories out and important information to the community. But just wanted to touch a brief moment on what it takes, what's behind the scenes from a public health point of view as we engage with media. I'm incredibly proud. We have a whole communications team that have been creating products in multiple different channels, whether it's social media, print, online. We've mailed things to people using traditional media as well. And we have to do this in multiple languages, but it's the media relations team, I think, that's most relevant here today that we're discussing. And again, the volume of work that they've had to undertake is incredible. And 3 times the number of media inquiries that we get in a whole year in just 6 or 7 months. And each inquiry we take as a priority to get the right information to journalists so that they can share accurate information with the public. We definitely had to pivot to doing media availabilities rather than one-on-one interviews with different media outlets almost every day initially in the pandemic. And it hasn't stopped. We've had to continue at least twice a week as usual, still 8 months later, because the information keeps changing, and there's always something new to let the public know about, to make sure they're informed and they can adjust as the pandemic changes and what needs to happen changes. So, it certainly hasn't slowed down. We do respect that journalists want one-on-one interviews, and so I try to make myself available for that as well. And it is a trade-off in terms of the time that I need to be spending with my team, leading the response, responding to things, that internal work and work with partners. It's sometimes hard to prepare for media availabilities, and very often we've been looking at information right up to the last minute before we speak with media, because we're trying to make sure that's always informed by the latest questions that are coming at us from different channels. Again, my inbox, the complaints and inquiries and compliments, the social media chatter. We want to be able to speak to what's most relevant to people, and so we take that all in and prepare for our media availabilities. The other thing we've noticed in terms of one-on-one interviews with me as a spokesperson for the public health response, it's important to have access to other public health workers in terms of our epidemiologists who have the data, our case and contact tracers, and that hasn't always been easy to provide because we are stretched. We are still stretched responding, but we appreciate that. So I've started to speak a little bit about the challenges. I think I'll focus my next comments there. No surprise to everybody, one of the biggest challenges that we continue to experience is that information about the virus and the pandemic and the response continues to evolve. So as we learn more about COVID, we have to change. Our guidance has to change. It's necessary. We should be adapting to the latest evidence and science, and so we would rather do that than stick with any outdated messaging or something that's not effective. But it does come with the added communications challenge of explaining why we are adapting or changing our public health guidance and messaging. We do trust the public to make good choices when they have the right information. And we've been very open. I think we've had some success on social media explaining through Twitter threads, for example, why information has to change on masks, I think was a key one early on. And we can talk more about that. This can't be easy for journalists either, to continue to adapt. I think a second challenge is, and this might be different for Canada, but probably not in other parts of the world, we have different levels of government, from national, provincial, and local. I sit at the local level, and the public health authorities at those different levels have to speak for a broader geography with a very varied experience. And I'm going to use Halloween as the example there. And again, maybe around the world, people don't celebrate Halloween as much as we do here in Canada, but it's a big deal. People love decorating. They love dressing up and going trick-or-treating door to door to get candy. And so the national advice on that is to mitigate the risk, to go about that trick-or-treating. And the national advice did say it may need to change based on what your local medical officer of health says, but that piece doesn't get picked up so much. And so then we're left at the local level trying to explain why our guidance might be more restrictive. And so that's one of the challenges. Also, neighboring jurisdictions. I am so proud and happy to work for the city of Ottawa. It's right on the border with a different province with different guidance. And so again, having that connection with our neighbors to overcome why there might be differences in policy. I'm sure will come up more, the third challenge of misinformation. I guess some people have talked about that it's just more and more that there's more and more misinformation spreading. I think it's not all lost. I'm not sure the misinformation people are winning, because we do see the effective behavior change happening. Like, we have turned the curve and flattened the curve through people's individual choices and behavior change. And so, I'm hopeful that people will, on the majority, continue to act on the best evidence they can get. So lastly, I just wanted to speak to one of the challenges I see from a public health perspective is that traditional media channels do not reach everyone. So when I speak to our usual larger media outlets, they are not asking me questions in languages other than English and French, and yet we have a very diverse population in Ottawa where we need to get messages out in more than those two languages. And so, that's up to us as a public health agency then to make sure that we're using different channels. So I'll finish by talking about how important I think it is to continue to tell the story of the pandemic and what we need to do and what's happening in different ways. We've seen media outlets reporting on COVID fatigue, and that's a real thing when it comes to messaging. So because it's the same, the public health message is the same, 8 months later in terms of the basics. Wash your hands, stay home when you're sick, keep 2 meters distance from other people, and wear a mask when you're indoors, and you can't distance. That's actually probably not going to change for another year, right? So we need to find new ways. And I think here again, the media is very important in terms of helping us tell that story, a story that helps people feel something, that evokes emotion. That is what people will remember. So we have seen our media partners picking things up and using their own infographics, sharing things, stories of people who have recovered. I think that these things are important, as well as what I'm seeing emerge in terms of some positive stories about what can be done. I'm looking ahead, and we have to make it in Canada through 6 months of winter. And, that is looming. We are starting into that period. And I think it's hard when the messages are all about what can't be done and the risk. And so I'm hoping that our partners in media will also think about how do we continue to generate hope and positivity and that connectedness that will get us through this pandemic. And I'm looking forward to that. Like, we will get through this pandemic. I hope one day we'll just have the weather to talk about again for a while, perhaps. And I can't wait until our interactions with our media partners can be more in person. It certainly is awkward speaking to a little black camera and not having, the direct feedback as we engage with journalists to help get information across. So I think I'll end it there. I look forward to the discussion and the questions. I think that may be part of the most interesting part of this time together. Thank you.
Thank you, Vera. Next, we have Carey Wu.
Good afternoon, everyone. Thank you for joining us. I'm Carey Wu. I'm a political sociologist at York University. Brent, can you share the screen, the slides? Okay, great. So back in March, I received a grant from the government to study the dynamic of trust before, during, and after the COVID pandemic. So 2 questions in the research proposal I asked is, first is like how public trust, including like people trusting each other or people's trust in the government or in media, and also people's trust in health professionals, right? So how that shape public responses to the pandemic. So that's the first question. Second question I ask in that research, or in this ongoing research, is that how this pandemic change or shape people's trust in each other, people's trust in the government, and people's trust in the media. So today I'm gonna show you some like fundings and some data and some like plans. So in very early stage in March, so this is the first article I wrote and published in a sociology journal, Context. So first article I look at is that in the United States, when at state level, when states have more trust, means that people trusting each other, then the state are more likely to get people tested for the COVID-19 virus. So the testing rate is higher in US states where people are more trust in each other. So one mechanism I would think is that when people trusting each other, like indicate the quality of the state government, right? So high quality of the state government, better governance, better government then lead to higher testing effort, testing rate. So this research is has been translated in multiple language. So when there's trust, there's more testing. So because this is especially important in early stages of the pandemic in March. And then next paper. So this is when I look at, this is in the United States as well. So when I look at county level, so the first map is the cases, the confirmed cases per capita. And then the next US map is the social capital, right? So social capital, including social trust, people trusting each other, and also including people's trust in the government, also the social network. You can see that when social capital is high, when counties with more social capital, they have fewer confirmed cases. And I also found the weekly growth rate is also lower in counties that there's more social capital. So that this shows that how trust matters for kind of COVID-19 response. Next. So, but when we think about trust or think about social capital, right? Vera talk about trust is a multi-level. So there's a local level trust, there's a national level, or people trust in local community level government, and the people's trust in federal level, right? Those different forms of trust could matter different ways, or they can matter in different responses, right? So cross-nationally, when we think about trust, right? So in some countries, for example, in Western society, here in Canada and the United States, really bottom-up trust is very important. People's trust in each other, right? But in authoritarian regime, for example, in China, people's trust in each other, maybe it's not that important than their trust in the government, right? Because they have very strict law rules. When the compliance with the control measures relied on people's trust in the government, right? But here, because in democratic society, people's trusting in each other matters more. So that's thinking about trust could be a multi-level, and trust could be also trust in people, trust in media, trust in political organizations. So those different forms of trust could matter for could matter differently for people's responses or government response to the COVID pandemic. So next. So when we think about in the US, when we think about media, right? So if you look at here, so this is trust in ABC, CBS, CNN, and then Fox News, right? So this you see trust in Fox News is so different from people's trust in ABC, CNN, right? You can see the loading. So this is a simple analysis looking at how different specific trust in specific news sources differ from each other. So for ABC, CBS, CNN, they mostly load on a single factor, but Fox News is so different from other forms of trust, specific trust. And next, so thinking about, right, so how trust in media could, for example, this is a simple analysis looking at how trust in CNN and how trust in Fox News change or shape people's mask wearing behavior, right? So in very early, so first wave, so this is data from the University of Southern California. So there's a team, they have been collecting the data over time from March until September. So the first wave of data is collected in March. So you see when people have more trust in CNN or in Fox News, they both are more likely to wear masks in early stages of the pandemic. But in wave 7, which is in July, June, so you see when people have trust in CNN, they're still more likely to wear masks. But then over time, more and more American has been wearing masks. You can see whether it's from wave 1 to wave 7, so the mask wearing has been increasing. But you can see the differences here between these two figures is that the second figure, trust in Fox News, in today, when people have more trust in Fox News in Fox News, they're less likely to wear a mask. So that's like how really like media or like Fox News or CNN News shape people's like social distancing or like those behavior, mask wearing behavior in different ways. So next, so all the previous slides I talked about how trust can shape people's response to the pandemic, right? So I also ask another question: is how the pandemic has changed people's trust. So for in the United States, for example, this data shows that people's trust in the government, in media, in the president, in Congress, all has been declining in the United States, right? But in Canada, so if you look at the next slide, in Canada, there has been increase in all public trust. People have become more trust in each other. People have more trust in the government, have more trust in health and media. In Canada, the data show, not media, I didn't show, but in Canada, people's trust in media has also been declining. But the most forms of trust in Canada has been increasing. So one reason is like over government here probably have done better job because trust reflects performance, right? So the performance could lead to higher trust in institutions, even in people. When people come together, they can form a solidarity, right? So when we face a disaster, then pandemic, right? So they could form a sense of solidarity and people have more trust in each other. When the government also do, like in a good institutional environment. So next. So this is trust in media in the United States. So you can see from March and June, ABC, CBS, and the people's trust in all those media has been declining, right? So that really, so the pandemic has changed people's trust in institutions, in media, right? So that's some data I'm sharing with you today. So I look forward to the discussion at the end. Thank you.
Thank you. Next, we have Christopher Waddell.
Thanks very much. That's on, yes. Thanks very much, Scott. Brent, if you want to go to the next set of slides, which you will get there shortly. What I'm going to talk about is a couple of rounds of surveys that we did at the School of Journalism and Communication in earlier this year. If you want to go to the first slide, Brett. And basically, the surveys were conducted by Abacus Data. We rewrote the questions. The first wave of it was done in early May when the pandemic was going pretty strong and we were doing a lockdown. Then we did a second wave in early July when almost all the country had at that point moved into, I guess, what you would call stage 2, which was a sort of modified opening, but not a complete opening of everything. Some of the questions I'm going to talk about today, they're all about the media and about news, but some of them we asked in both waves. There wasn't much difference between the two waves. They were pretty much the same in the responses. Some of them we just asked in one wave or the other, and so I'm not going to identify which wave they're in. It doesn't really matter that much, I don't think. So, and it was a project was funded by the School of Public Affairs, Faculty of Public Affairs at Carleton. Brent, next slide. 2,000 people we surveyed for each of the two surveys. We weighted the results for usual demographic factors, a margin of error of 2.17 if it was done on a traditional basis, but this was an online survey with a panel. University disseminated the results. All the news releases are all available on the school's website, and the results I'm going to talk about are the cumulative results, but obviously you can break this survey down by various demographic categories, whether it's education, age, family income. We also split it by suburban, urban, and rural residents so that you could see if there was a little bit of differences. And in some cases there are some differences, but I'm going to talk about the national results for this presentation anyway. So next, Brett. First question we want to deal with was, to what extent would you say you kept up with the news, both before the pandemic and during the pandemic? And as you'll see, at the bottom of the slide, much more people were following the news every day once the pandemic was underway, and we saw a shift in responses there. Next one. We also asked them where you're getting your news and information, and there was and we asked them first to. I'm just going to drop something down here on my screen. Better. We asked them first to tell us all the sources, and this is the result we got. On television news is clearly ahead. We just added them all up. So about 2/3 of the Canadians say they get their news from television newscasts and news channels, search engines, government online websites, radio, as we move down through all the different categories. Obviously, if you add up all the different online sources, online cumulatively is probably higher than television, but television is still a very significant presence. You'll see, you may be a little surprised to see social media in there. It's in fifth, but when we go to the next slide, which is the top 3 sources, we've got TV at the top, then public health agency, government online sites, and it goes down from there. And social media is much lower in terms of the top 3 sources for various people, although we'll have more to say about that a little bit later on. Next slide, please, Brett. We asked how good a job do you believe your local news media is doing keeping you informed about COVID-19? And you'll see it was very good. Almost 80% of people thought the news media was doing a good or a very good job. That didn't change during the 2 surveys. It was pretty constant. So the public seemed fairly happy with the news and information they were getting from the media. Next slide. We also asked, though, about what different types of news: local news, provincial news, national and international news, because obviously in the early days of the pandemic, international was very important in terms of what was going on in other countries, as we saw it getting worse in Europe and then coming to Canada. And the results here aren't too much of a surprise either, I don't think, in that both local and provincial news were deemed more important than national or international news by people, because they wanted to know what was going on in their own community and what was going on in their own province. But even you've got significant number, almost 90%, saying that international news is very important or somewhat important, which is probably higher than it normally would be on a general news, question of general news rather than on specific COVID. Next, please, Brian. We also asked them which news sources they relied on for COVID-19 news information, and how important were the following factors in determining what they would rely on. And as you'll see again at the bottom, reliability of the information is most important, with about 3/4 of people saying that's what was the big determinant in what news sources they relied on for information about COVID. Relevance to where I live was almost half the people. Equally, the cost of subscriptions for online was almost half as well. And then much lower was, at least for very important, was compatibility with my opinion and worldview, although it was a little bit higher for somewhat important. So, but not a surprise again, but it's encouraging, I think, that people were looking for reliable information and they felt that the reliability of information played an important role in where they were going to get information about COVID-19. Next. We also we asked some questions about news and the cost of news and the ability of people to subscribe and what they would pay for. We asked, do they agree? As you may recall, most news organizations made those that were behind paywalls, made COVID-19 news free and removed them from behind paywalls. We asked if people thought it should be accessible online from news sites free of charge. And we had, not surprisingly, about 90% of people agreed and said yes, that all news and information should be free. So, and very few people disagreed with that. Next. We then went and asked whether they thought all news in general should be free and should be accessible online free of charge. And discouragingly enough for news organizations, about 80% of people thought that yes, all news should be free all the time. Not just COVID news, but all news. In other words, they didn't want to pay for any news online. Next. We asked, as we all know, and we've heard this morning, if you've been listening to any other panels, people talking about the problems that news organizations are facing financially as a result of advertising and other issues that have been going on for quite a while. So we asked, we said news organizations are struggling to remain in business due to the economic downturn, and we asked whether people agreed with that or not. And basically, we've got about 1/3 of the population that agrees with that, another 1/3 that either doesn't agree or disagree, and then the final third disagrees. So the ability of news organizations to present to the public their financial problems doesn't seem to be getting through to the public very well. And that's not something we've found exclusively. That's been a finding in other surveys as well. But even during the pandemic, that wasn't something that the public seemed to understand or appreciate. Next. Yes, well, the access to free COVID-19 coverage on online news websites that normally are behind paywalls lead you to pay to subscribe to those news sites in the future. You'll see you've got 8% say yes, and another 22% say maybe. So maybe a third might think about subscribing to news online as a result of getting free COVID coverage during the pandemic. A big chunk of Canadians won't though, and that's consistent with what other surveys we've done and other people have done that looks at people's willingness to pay for news. Next. And we also asked if you purchased or canceled a subscription to an online news site since the COVID pandemic began. And you'll see almost 90% have neither purchased nor canceled. You've got about 5% who bought a subscription. You've got about 6% who canceled the subscription. So for most people, it appears that that the pandemic and the availability of news hasn't led them to be more interested in subscribing to news, and they still have pretty strong opinions about their unwillingness to pay for news online. And I think that leads us to a few questions about social media. Next. Yeah, how much content about COVID-19 have you been seeing on social media sites you use? And you shall see, we've got about a third saying a lot, another third saying some, and the rest saying not that much. So not, again, that third split we see on this one as well. But clearly for the social media, people using social media, COVID-19 was a fairly prominent for a lot of them. Next. Do you disagree or agree with the following statement? The spread of misinformation about COVID-19 has made me more cautious about the accuracy of content I share with others. Perhaps encouragingly, we see about 2/3 of people somewhat agreeing or strongly agreeing with that. So the degree to which, at least in May and July, the degree to which the message about misinformation being spread about COVID-19 and the need to be cautious about that if you're sharing information with people was getting through to a fair amount of people and seemed to be having some sort of impact. Next. Have you accused someone else on social media of spreading misinformation based on content? Almost 80% of the people said no. You've got 3% who say yes. They're probably the most active on social media. But it clearly is spreading misinformation is something lots of people said they weren't doing. Whether in fact that's true or not, we don't know. But it's not spreading of misinformation was not a widespread activity for most Canadians. And last couple. Yeah, we also were interested, as the last couple of slides, we're also interested in how often Canadians check the various social media platforms. So what you'll see from the next two slides is that Facebook, YouTube, and Instagram are clearly the most popular. Facebook, if you combine Facebook and Instagram together, obviously it's being owned by the same company and increasingly being integrated into one. You'll see they are clearly the dominant presence on social media. YouTube is fairly significant as well. You've got 20% of people saying they check Facebook several times a day and another 17% saying they're checking once or twice a day. And that goes down as you move to other social media platforms. If we go to the next page, Snapchat, LinkedIn, TikTok, Tumblr, Sina Weibo, they're all down in very, very, very low numbers in relative terms. And finally, for the last couple of slides, we also asked people how many times they checked. We asked them if they didn't check at all on the site and if they'd never heard of the site. And as you'll see again, Facebook is at the bottom of this list, which means more people were checking Facebook than anything else. YouTube is next, but when you get up to this, beyond YouTube, if you go to Instagram, Reddit, Twitter, and the next slide, you'll find all these social media sites. You'll find about more than 60% of the population, almost 2/3 of the population, in fact, are not using them at all, and in some cases have never heard of them. So to wrap up in a really quick presentation, couple of quick conclusions. We draw a few tentative conclusions. Canadians thought the media handled the pandemic well in May and July. The survey also found them very positive about the performance of public health officials and governments. Mainstream media, both in their original formats and online, remain very important sources of news and information for Canadians. Television is most prominent in that. That's nothing new. Television has been the most prominent for quite a long time. And as I said earlier, if you add up all the different online sites and online sources, that may be beyond the total for television. But many of those online sources are repeating what is actually initially being published by mainstream media. So mainstream media is clearly still very significant in disseminating information. Canadians still have little interest in paying for news online. The traditional numbers have been about 9%. The most recent Reuters Institute survey of a bunch of countries had Canada up at 12 or 13% of people saying they'd be prepared to pay for news online. But the answers on the questions about do you think all news should be free online all the time are pretty discouraging for news organizations that are struggling to survive, which the public doesn't seem to be that aware of much on most part, and also having trouble finding people to pay for news online. So making COVID news online free during the pandemic may be good public policy, but it may be a bad business strategy because it seems to reinforce a sense that if you get something for free, that's what it's worth. There's no real evidence that making news, COVID news online free to public made people more interested in subscribing. That's a connection they weren't really making, at least in May or June, July. And finally, the last slide. All the attention paid to misinformation online does seem to be making Canadians more cautious about ensuring the accuracy of things they share. Facebook is the dominant social media platform, and that's reinforced if you combine the results of both Facebook and Instagram. And as for the frequent focus on social media during the pandemic, I think it's important to note who's not on social media, and that seems to be, as it relates to COVID-19 news, about 2/3 of Canadians, except for Facebook and YouTube. So that's, again, just a couple of surveys done in May and July. Obviously, different surveys can produce different results, but that's what we discovered then as it relates to Canadians and what they thought of news.
Thank you, Chris. Next, we have Jamie Poisson. Looks like you're still muted, Jamie.
Hi, can you hear me?
Yes.
Okay, can you see me? Can you see me okay? Sorry, as soon as Chris finished his presentation, my screen just went blank.
Looks like you're back with us.
Okay, but you can see me and hear me. I can't see you guys, but I can just go ahead. Oh, wait, I'm back. I can see you, sorry. Okay, hi everyone. For those of you who might not be familiar with the show, I host Front Burner. It's a daily CBC News podcast. And generally, we launch an episode every day, and it drops at 6 a.m. It's about 20 to 25 minutes long, and we dig into one subject. What we decided pretty quickly when things started to get very real around March was that the story was moving so fast, and faster than any story I have ever worked on. The amount of information and changing information was really quite something coming at you. It was moving so fast, and there was such a desire for clarity that we launched a second podcast, which we dropped into our feed every day or a couple of times a week. We actually just sort of decided on the day of if there was a really pertinent question that we needed answered. We would drop that into our feed at the end of the day. And these were shorter episodes, maybe like 12 or 13 minutes long. And we tried to tackle a very specific COVID question. Our morning episodes were often still COVID focused. So it was just like COVID all the time in March. But we really wanted to give our listeners the opportunity to be able to go through our feed and say, oh, like this is a piece of information that I need. I'm going to listen to this quick 10-minute discussion trying to explain what's going on with testing in Canada right now, or why the WHO just declared this a pandemic. So what are some of the things that we talked about a lot as a team and tried very hard to do in order to engender trust? We time-stamped most of our conversations, which seems like a small thing. But as I mentioned before, the story was moving so quickly that we were always trying to remind our listeners that this is, Tuesday at this time. This is the information that we have right now. This is what's coming out right now, because it was changing all the time. We were always trying to remind people that this could change tomorrow. This advice on masks could change tomorrow. So that was really important. It was really important for us to make sure that we put the proper context around all the discussions that we were having. Scientific studies, for example, we would never cite any study without having a conversation with the person we were interviewing about that study. Is it peer reviewed? Is there broad scientific consensus? What kind of journal was it in? What's your take on the validity of the study? I think it's important sometimes to talk about scientific information that's just coming out. Like a lot of this was coming out as it was being done, and that doesn't mean that we shouldn't report on it, but it was so important that we put it in the proper context. Another thing that we had a lot of discussions about as a team was finding experts who are excellent science communicators and could speak to our listeners in a way that was easy to understand, and it seemed fair and down to earth and real. And so for example, Dr. Isaac Bogosh is a regular expert on our program. I find him to be just an incredibly effective communicator. He's not only is he using sort of plain language and often sports analogies to discuss COVID with us, but also I find that he's quite honest. I remember once in his takes, right, and willing to sort of criticize the government if he thinks that's or public health officials too, if he thinks that's warranted. I remember one time, I asked him, there was a lot of discussion around testing when it was right early in the pandemic, and the Prime Minister's wife, Sophie Gregoire, had COVID, and the Prime Minister kept saying, I don't need to get tested. The advice is I don't need to get tested. And, I remember asking Isaac, this doesn't make sense to me that he doesn't need to get tested, because all of these other countries around the world are saying test often, test as much as you can. If you've been in contact with anyone with COVID, get tested. Is it possible that we just have not got our act together around testing? And, I think his answer to that question was incredibly, his opinion, obviously, but it was honest and it was fair. And so I think that, we've relied on people that we go to often. And I also think that helps build trust with listeners too, if they're often hearing from the same people over and over again. Dr. Michael Gardam out with Humber River Hospitals, I think he's out east now, but he's an excellent communicator as well. Cameron Kahn with he's doing incredible work around data right now. He's basically predicted sort of how this pandemic was going to spread. So we relied heavily on recurring characters on the podcast, or I shouldn't call them characters, but recurring experts to help us wade through how the complexities of the story. We fact check all of our episodes. So I think that's an important thing to say as well. After they are recorded, obviously we do a lot of research beforehand to make sure that we get the questions right and we get the information right, and then we fact check them afterwards. Sometimes that means that they don't go out, as the afternoon episodes in particular didn't go out as quickly as we might have wanted them to, but we felt that it was really, really important to take that step so that we didn't have to pull things back. Another thing that we focused heavily on is as soon as we started seeing confusion around specific issues, we thought this is where we need to jump in, right? So hydrochloroquine, when Donald Trump was touting the benefits of hydrochloroquine, let's do an episode on that. Let's get it out quickly. let's try and figure out what the scientific consensus is here. We recently did one on Regeneron that Donald Trump, again, was calling a cure. This is like the monoclonal antibody cocktail that he received. And, Isaac came on and explained that this is still a very experimental drug that's not available in Canada, that we don't have the data. We do not know if it's a cure or, and I should say, sorry, it's not a drug, it's a therapy. And so we went through that step by step. And so that was, I think that's an important role that we played in trying to build trust with our listeners. We talk a lot too about, the context around, what we know about these drugs or these therapies right now. We also tried to spend a lot of time debunking misinformation, which I suppose is very related to what I just said. But there was that theory going around that the virus had come from like a Chinese lab. So we wanted to do an interview, an episode on how there's really no evidence that was largely thought to be a conspiracy theory. We spend quite a bit of time researching these episodes, as much time as we can for a daily show, just so that we are able to sort of deliver like a broad scientific consensus. And the other thing I'll say to try and engender trust with our listeners is that I think it's important to ask questions of both public health officials and the government throughout this process. So, we asked a lot of questions about this, the wobbling on the masks, don't wear masks. When we were being told to not wear masks, we asked quite a few people why that was the case. It seemed to sort of intuitively not make sense. Like, just a question I had as a regular person is, I see doctors wear masks in hospitals all the time. So obviously they're working for something. I don't understand why we're being told to not wear masks. The argument that shutting down borders doesn't work, and then all of a sudden we are shutting down the borders. So why the quick turnaround there? And then I think it was also fair at the time, and it's still fair to ask the questions of the response here. When government officials, this virus was on their radar, how quickly they acted, why we seemed to have been caught flat-footed. We did not have enough PPE. You had hospitals begging the government for PPE. This our great shame in long-term care homes and our inability to protect them. I think these are really important questions that still need to be asked, and I'm not sure we've gotten. Actually, I am sure that we have not gotten sufficient answers to any of them quite yet. At the same time, it's important to be fair. While I think Canada was caught flat-footed, so was the majority of the world. So where we can put that context in, that's important as well. I think it's also important to question some of the messaging from public health officials. Dr. Etches just mentioned the messaging around Halloween. I know that local health officials have different advice, but even that advice that's coming down from public health officials, there are several experts that disagree with that. So, I think that that's an important discussion to have, and the podcast is a really good environment for that, because we can get into the nuances like back and forth and really kind of dig into it. And then the other thing I wanted to mention that Dr. Etches talked about is this idea of fatigue. And so it's always really important to try and tell compelling stories. The podcast in particular is not like people have the radio on in the background or the television on in the background. You have to physically take out your phone, open up your podcast app, click on the episode. We're trying very hard to make this an enjoyable experience for people too, to get their news. And so that's not lost on us on like a daily basis. And I think that also helps build trust too. to try and draw people into a story. So we put a lot of effort into some of the stories that we did on long-term care homes to get first-person stories, to get families who have been affected from the front lines here. Migrant workers, we tried very hard also to put their voices on to the podcast. And I think that that's a really important role that the media has too, to battle that fatigue. I will say, even personally, I was feeling a bit fatigued in the summer myself. And I picked up the newspaper, and my colleague Jennifer Yang had written this unbelievable piece about this young man in the northwest corner of the city of Toronto who lost his mom to COVID, and told the story. He has autism, and he basically was like left on his own with his little sister in their apartment while she was battling COVID in the hospital, and she ended up dying. And then he's like left on his own here in Toronto. His father was on another continent. And I remember reading this and thinking to myself, wow, like, why am I complaining about like not going to a restaurant? This is crazy, right? And so I think it's always important to remind ourselves about, as journalists, that these stories actually do matter, that they actually do affect people's behavior. And I know this because I have read or watched stories that have very much affected my own behavior or attitude. So this is sort of what we're thinking about as a podcast on a day-to-day basis. And I hope that we can continue this conversation now.
Thank you, Jamie. And yes, I think these opening remarks have really given us a great starting point here for a conversation. I'm sure I'll have many questions here from the audience, but I'll start with a question addressed to the whole panel. So this was touched on in some of your remarks, but in a situation like this, it's unavoidable that there's going to be some uncertainty or a change in the evidence base or a change in our understanding of that evidence base. So could any of you speak further to some of the challenges that this presents when we're communicating with the public, and how we navigate those challenges in a way that maintains that really crucial trust?
I think I had made a couple comments related to this, the importance of continuing to be transparent about what was said before, what we're saying now, if there's a difference, why there's a difference, explaining what we use as evidence, and that we often, in a time like this, especially early on, we had to act on incomplete information and evidence that's not peer reviewed, and acknowledge that. So even at the time saying, there isn't much information about masks, right? We said that, and then the information that was showing there's asymptomatic transmission, that was not peer reviewed, but it was enough. It had enough implications that we had to think about. We have to act on this information to change our policy, to consider that anybody out there could have COVID and could be a source of risk to others. And that was a big change for sure. And it's gratifying to see that the evidence becomes stronger and is upholding, the shift in approach. But that's one of the challenges. I think there are policymakers who won't shift until evidence is really clear and peer reviewed, and that's going to cost lives in a pandemic. So we have to act fast, acknowledging the uncertainty, being upfront about that.
Can I add something, Scott? And I think one of the challenges that journalism faces in dealing with something like this is that journalism and journalists are interested in facts, what's right, what's wrong, and scientists never will say anything definitively because they're always waiting for whatever the next study might be or whatever the next result might be coming along. And when those two things are mashed together, they often don't work together very well. So, and I think that's probably compounded in a circumstance such as a pandemic, when many journalists are thrown into covering scientific and health issues who don't really have much experience in doing it. And I think that becomes a bit of a problem. How do you translate, or how do you put information across to the public with the caveat that this is what we know today, but that might not be true tomorrow, when we're used to writing stories that say this is what is the truth. And that's a real, and I don't know that, you know, everyone, I think everyone's been grappling with that who's been trying to deal with the issue. I listened to Ed Yong this morning in the first presentation talk about some of that. And it's a problem even for people who are specialists in the field, and it's even more challenging for people who may have been a general assignment reporter or doing this, that, or something else, all of a sudden thrown into this as well. And I think people have grappled with how to deal with it in a fair fashion.
Sorry, maybe I'll add, you know, one thing that has been important that I think about a lot is you want to try and ask the questions that people sitting on their couches at home are wondering, right? Like, why am I suddenly being told to wear a mask? Or, you know, when I was told to not wear a mask 2 weeks ago. Why am I suddenly being told to go get tested when I was told 2 weeks ago I don't need to get a test? And I think it's important to put those questions to trusted experts, but you have got to also give them the space to answer and get into the nuances of this discussion that Dr. Esches was just saying, that they're also grappling with this as well too. So really, I'm not saying it always happens, and even for myself, sometimes I leave interviews thinking maybe I wasn't fair, or maybe I should have been a little bit, I could have been more fair there, or maybe I didn't ask enough skeptical questions. But I think you're always trying to approach those interviews like, what are people wondering about? And then now I'm gonna give the space to answer these questions. So, sometimes just asking the question is enough, because you get a very satisfactory answer. You know, and sometimes for some people it's not, and you just keep asking them. But anyways, I think it's why also I found the podcast format very helpful for this, because we have a bit more time to like go back at something for a couple of follow-up questions, just to give people like maybe a little bit more clarity.
And what's important in that is that the podcast lets you do it. Whereas if everybody's watching television, they're listening for the 4 or 5 second clip, and that makes it really difficult difficult issues aren't often explained in 4 or 5 seconds.
No, especially this one. Yeah.
Or in a few sentences in a tweet.
Right.
And so our team has decided there are some things where we can't put it in one tweet, and we're going to use threads. And you know, I feel, you know, sorry for them. They're having to use more threads than they probably want to use, right? Because there continue to be things that require that longer communication.
And there's also a political dimension too in all this. And that if you go back, and I mean, Vera may want to disagree with me on this, but if you go back to look at the early days of advice about masks or not wearing masks, clearly some of the advice about not wearing masks related to the concern about the ability to have enough masks for medical personnel who were dealing on site with cases. But if public health officials start to talk about that, then the public says, well, who's responsible for that? The politicians, and they're the bosses of the public health people. So there's dynamics and tensions in all this that are some of which are more obvious than others. And I'm not going to ask you to comment on either of that. But clearly, in retrospect, when you hear people talk about masks, and I know that the science of it was evolving, some of the concerns relate to the political dimension as well.
I find it very interesting as a medical officer of health, because we fall into the category of physicians and doctors that have high levels of trust, but people do see us as government as well. And so, you know, it's interesting role. We do have the ability to speak out independently where it's important for the health of our population. And, you know, that's a responsibility I have, and an ethic that I follow. But I know there's different views. For instance, you know, Jamie, you referenced a lot of your sources are infectious disease physicians who are not public health physicians. And this is a public health pandemic, and the responses that are required to control it are public health oriented, not the individual infectious disease care of a patient. And so it is interesting, though, that is still seen as a more credible spokesperson sometimes because they're not associated with government.
We have a question here for Jamie Poisson and Dr. Etches from Ivor Shapiro. They say, in Dr. Teresa Tam's keynote session, she noted that members of the public can recognize credible information as opposed to misinformation when the journalist or the scientist recognizes a variety of perspectives or findings, rather than focusing on only a single simple answer on complex scientific knowledge that's still evolving. Jamie also alluded to the presence of sometimes conflicting science-based information and advice. Question, do you agree with Dr. Tam that this applies to news stories in the pandemic? And if so, how do you balance this need for a variety of scientific perspectives against the perceived need for clear information on which the public can rely and trust?
I think I agree with Dr. Tam that it's important to speak about more complex issues and the more complex science that is out there. We still do have to be simple in our messages. People, if we're asking for action, right? If we're looking for people to pick up a behavior or do something, that has to be simple. But there are other forums where you can discuss things more with more nuance. So I'm trying to think of, for instance, schools, right? And opening schools, and is that a risk for COVID transmission? Do children transmit COVID? There's lots of different science there. We know this about children. We don't know this about children. And we can speak more if there's a specific subject. We might choose to make a media availability based on one subject, so we can go a little bit more into depth around that and talk about what we know and what we don't know, and bring in more of the complexity around opening schools, right? It's not just about COVID. It's also about the mental health of parents and children and their development. And it's also about people being able to work and needing to get our economy recovering. So I think sometimes we have to narrow the focus and go deeper, and that is possible. I do believe the public can understand complexities and acknowledge that there are unknowns.
Okay, I hope this answers the question, but on very complex issues, the school one is a good one. We usually pull, I know this is a bit conflicting to what I said earlier, that we were trying to move quickly with the news, but we usually actually save those for our longer episodes, and we try to give them more time. So we work very closely with the CBC health and science reporters and our unit there, and then our producers will call multiple experts. And then we spend quite a bit of time on the structure of the conversation to try to put it all in context and try to say where the majority of the, if there's a majority of scientific consensus somewhere, we want to be able to say that. Or if there are many reputable sources saying the same thing, we want to try and grab all of those and put them together so that you're not trying to present two equal arguments when you've got so many people over here agreeing with this. And so I think in cases like that, trying to wade through the tricky ones, when we can, we try to take more time doing them and consult multiple experts, even if they don't come on the show.
All right, thank you for those responses. We have another question here. It says, is there data on the extent to which the uptick in trust in government is attributable to factors other than the reliability of science and health info, such as demonstrating compassion and rapidly rolling out income support measures?
I can start on that maybe, and that certainly we haven't done much in the surveys we did them in May and July when the income support measures were still coming out, and some of them weren't particularly clear and they were changing. I think the most, probably the most, it's not data, but it's a little practical. The New Brunswick government had an election on September 14th, I think, 11th or 14th. And minority government got turned into a majority government. There's a BC election on Saturday, in which the NDP minority government is going to probably most likely become a majority, if you believe what public opinion polls say. The Saskatchewan government's has an election on Monday. Its majority government is likely to get reelected. And people who were watching what's going on in Ottawa in the last couple of days suspect that that the Liberals wouldn't mind having an election at the moment if they had to, because the public has given a fairly positive response to the way the federal government has handled the issue. So I think I'm sure there's some of the good public opinion pollsters in the country, Abacus Data, Nanos, Angus Reid, Leger, those people have looked at some of those issues. But on a practical level, the way voters seem to be voting, it seems to be indicating their support in what government has actually done. And the surveys we did where we asked generally about how happy you were with or how you rated the performance of your local government, provincial government, and federal government, found even back in May and in July, 65% or so or higher people thought they were doing a very good or good job.
Would anyone else like to respond to that question as well?
I don't feel I'm in the best position to comment on how I'm doing. I'll leave that to others to judge.
We have another question here. So Jamie, in a recent episode of Front Burner, you were speaking with, I think, Isaac Bogosh, actually, and you were talking with him about this idea that rapid testing helps some of our issues, but not all. And something that struck me in that episode, and it's a long-running theme with your podcast, is that you strike this balance where you explore these sorts of challenges and issues that we're facing in the pandemic, but you do it in a way that doesn't seem alarmist or that gives fodder to, maybe some sensationalist or distrusting impulses. So I'm just wondering if you could share anything about your process or approach to kind of negotiating that balance and its connection to public trust. Oh, it looks like you're muted again.
Myself, sorry. Thanks for listening to that episode. I think it's trying to find the time to structure the conversations properly. I think when you are moving very quickly, it's easier to grab onto more alarmist facts. And I think it's also a recognition that people are listening to you. While it's so important, it's more important for all of these experts and public health officials. People are listening to them, but people are also listening to us. And so I think the way that you try to navigate the questions themselves are important. How you pose these questions to experts are important. And I hope that when you come away from an interview, the impression that you can leave is that was fair. It could be tough. It could be it could be tough, but hopefully that it was fair, that like everything was given a fair shake. So we actually try to spend a lot of time talking about this before we go into the conversations. Sometimes days, sometimes hours on like now Zoom calls with our team, trying to figure out if we're being fair here. We don't always hit it, I will say. It's hard with this story in particular, but I think when you don't hit it, and people will tell you that, then it's important to evaluate that and then maybe go back to it if you can.
I thought I might jump in here, Scott, to say that we have, as public health physicians, I actually don't have time to watch the news, but the team watches the news, and if we come across something that is inaccurate, like that doesn't actually reflect the evidence or the reality, we have reached out to journalists to say, can we chat about that? Can we offer some other perspectives? And people have taken us up on that too, and I really respect that that ongoing dialogue to be able to give people the best information.
Sure, thank you. I have a question for Dr. Wu, and then perhaps others can also jump in. In your presentation, the way you're speaking about trust, you added this kind of interesting granularity to it, where we often, or maybe this is just, I myself think about it as trust or lack of trust, but you were talking about where we place our trust and what types of news, which different platforms, which different figures. So I'm just wondering if you could speak any more to that, this idea that it matters where we place our trust, and maybe some of the challenges when it's not that people are mistrusting, but they're placing that trust. I won't name names or specific media outlets, maybe Fox News, but how we address that trust that's being placed on a platform or with a figure that perhaps it shouldn't be.
A very, very good question, right? So when we think about trust, it's like really is a multi-dimensional, right? Or it's like the different forms of trust, or the target could be different, right? Trust in health professionals, trust in the government. In the government, we are talk about national level and local level, community level, right? So people's trust in local, provincial level means differently for people. For example, here in our province, Ontario, or if you trust in federal, it means different too. So so that's political trust, institutional trust, right? So when we think about media, trust in media, there was also different news, right? Some like Fox News, CNN, you see there's a political divide, huge political divide. When people have more trust in Fox News, it's so different from others who have trust in CNN, or so that could people are divided by, for example, trust in Fox News and in CNN in the United States, or even in Canada here, right? People trust in CNN, Fox News, right? So the finding I show is that when people, very early stage of the pandemic, when people have trust, so that trust in general could be a diffuse type of trust, right? So it's just people simply trusting or lack of trust. So that matters little, or like could shape people's mask wearing. But then when you're getting into political debate, right? So when people trust Trump, or people trust Fox News, then they're less likely to wear mask relatively to people who trust in CNN or trust in some other more liberal or democratic kind of like media outlet, right? So and we think about social trust is also so type of trust, and then a level of trust, and also cross-nationally in different contexts, trust could matter, for the COVID response in different ways, right? So I talked about like in Western society, in more like democratic regimes, like social trust or like those community trust matters more than institutional trust, like trust in even in the political government, or even in health professionals, right? So social trust, people care about each other, concerned about each other, matters more than people following the control measures like top down, right? But in for example, in authoritarian regimes, top down, and then those control measures is more strict. So then you have to follow, then you trust the political government, and you're more likely to follow. So like it's very simple in that way. But in Canada here, it's more like, okay, so trust also matters in different timelines, right? So early on, when government still like thinking about what policy, what control policy we should, for example, when we don't have a lot of control policy in place, then social trust matters. But when we have a lot of control policy, or mask wearing policy, social distancing policy in place, then social trust matters less. The political trust become more important, right? Or trust in health professionals, right? Because if people trust in health professionals, they follow their advice, their policy suggestions, then they do social distancing, they wear masks, right? So it's not about social trust anymore. So yes, so when we think about trust is a multidimensional, trust is a multi-level concept, and trust could also change different time, different context, right? So it's a complicated concept, trust.
For sure. Thank you for your response. Does anyone else want to build off that?
You muted, Chris.
I was muted. Sorry, I hit the button and it didn't unmute me. The research that's been done in Canada and internationally suggests that Canadians have much higher levels of trust in the media than Americans do. There's a good survey done by the Pointer Institute. By Pew Pew in about, I think it was early 2019, that looked at 25 or 30 countries and found Canada, in fact, was about 20 points higher than Americans in terms of trust in media. I think there's a variety of reasons for that. One of which is that media has been a politicized weapon by parties in the United States going back to Spiro Agnew and Richard Nixon in the early 1970s, where the media has been denigrated as being liberal and those sorts of things. And it's become a political issue. It hasn't nearly to the same extent in Canada. It really hasn't hardly at all in Canada. I think the public broadcaster in Canada makes a difference. The public broadcaster is a significant presence in the media in Canada, and that plays a role in constraining some of the perhaps instincts to move towards more extremes in some media. I think another reason is that we don't have Rupert Murdoch, and I think that's a significant reason for the higher trust in media in Canada than in the United States, for instance. But generally there's and then the overriding reason above and beyond all that is if you want to get into big views of collective versus individual responsibility and individualism, and going back to the founding of our country versus the founding of the United States, and all those sorts of things where we tend to trust government more than Americans do. And in a situation like this, that makes a difference. It sometimes works to our detriment too, when we are too willing to accept government's unwillingness to share information with us. And things like that. But there are big differences between us as societies, bigger than some people think. And that is reflected, I think, in the trust in media in the two countries.
Thank you, Chris. We have a question here for Dr. Etchett. So this is getting at the complexity of scientific and medical information. The fact that, as you and others spoke about in your presentations, that clearly, you want that to be communicated to the public in a way that they understand, and also that the public is capable of understanding that kind of complexity, and not wanting to oversimplify the facts. You've spoken before about the importance of storytelling. Do you think that storytelling helps us address that complexity?
Absolutely, and I want to thank people for continuing that work in the media. Our own attempts at storytelling have been related to what we're finding when we follow up with somebody who's tested positive about the second and third generation, what we find with the contact tracing, how quickly COVID can spread from a social setting into schools or into workplaces. And that kind of actually relating something that is what people could imagine they were doing, like having a party at a cottage or having a barbecue in a park. It brings it into a more tangible, oh, it could be me kind of sense. And then, oh, the consequences could be drastic pretty quickly. I think it makes it more real. So we'll continue those storytelling efforts. I think it has been said, we get feedback from our city councillors who report to you that we need more stories about individuals who have come through COVID, individuals who have been impacted by COVID. And for us to do that kind of reporting, we have to get consent. We have to go, that's probably more the domain of journalists. And in fact, I think, as you were saying, Jamie, it can be very, very strong. I think the other thing we know is that the stories that are positive are harder to get media attention placed on them. There's more when there's more conflict and there's more angst or outrage, that tends to get attention more than the survival, the supporting each other's stories. So we acknowledge that, but I think that's a gap in mainstream media that maybe we need to spend more time focusing on in public health.
We have another question here from the audience. Do you think the media's tone towards government has been affected by the pandemic? Has it done anything to foster or lessen levels of public trust?
I guess I may try that. I'll start and let or Jamie wants to start.
No, I'll jump in after you're done. Yeah.
Okay, let me pick up on something that Vera said though. First, is I don't know if you saw it or not. There was a really interesting little. There's been some people playing around with some very good ideas of how to communicate some of the information graphically. And there was the London Middlesex Health Unit did an interesting one that was around 4 or 5 students at Western who were going to Western but weren't living on campus, contracted COVID-19, and then a graphic demonstration of how that spread by who they took bus ride, who they took car rides with, where they shared a cigarette, and that sort of thing. And some of those ways can be kind of interesting, and maybe ways to engage the public and persuade them how quickly it can spread. I mean, I saw I saw another one the other day. I don't know, it might have been an Ottawa one.
We've been doing that. Yeah, we've been.
Yeah, was that the hockey teams and that sort of one that I saw? That was quite good too, actually. They're really great ways of showing people in a way that I think is much better than just trying to talk to them. But now I forget what the question was, Scott.
The question
trust.
was asking if the media's tone towards government has been affected by the pandemic, and has it done anything to foster or lessen levels of public trust?
I don't know how to answer that. I think it's very difficult to describe the media as a monolith, because it really isn't. It's a whole bunch of different organizations. It's a bunch of different attitudes. It's a bunch of different, it's opinion, it's news, it's everything else. So my guess is probably the media was, my guess is probably not much, but I honestly don't know. Jamie's smiling, so she probably is smarter on this.
No, I'm not. I don't know the answer either, but I think it's important to remember that journalists are people too. And when you find yourself in a crisis, there is this tendency to rally, right? And we saw this in March, and I'm not saying this is a bad thing, but you want to rally around, you want to try and deal with this crisis. And so I think as a journalist, you constantly have to check yourself. There is something sort of patriotic about what happened in March, and when everybody went home and stayed home, and the idea was that we were going to do this together. And I think that that's really important messaging. But as a journalist, it's really important to constantly check yourself and try to remember, are there questions on the table here that we need to be asking? I think obviously there's broad consensus that this is not the time for austerity in this country, but recent figures show that Canada is spending more money than any other developed nation in the world. So there are some real questions here about whether or not that money is being spent properly. And I know that it's helping a lot of people, but I think that it's really important that those questions get asked now, like very quickly. We don't want to ask them 6 months from now or a year from now. I think they need to be asked right now. So anyways, I don't know if the tone towards government has changed, but I can see how it could. And I can see how, it's important to constantly remind yourself, to ask tough questions. What are the tough questions?
Yeah, I mean, I think it's really difficult. I mean, one of the questions that's been debated around to some degree is government relief efforts leading to disincentives to work. And I don't think there's an easy answer to that. In the short term, the answer is probably not very much. And we don't know the answer, what it's going to be longer term, because we don't know how long some of them are going to go on. But those are the questions that need to be asked. And at some point, on a political level, the debate about, I think this is now the federal government that's gone the longest of any federal government without having a budget. And I think people need to see how money's being spent, and while acknowledging that there was a lot of effort done to get stuff out quickly and early, there's also good questions to ask about how it's being spent, and of course, questions some are asking about what are the longer term implications. But probably on a political level, the people who think that the media is too friendly to government will still think they're too friendly to government afterwards, and people who think that the media is too tough on them are probably dependent upon which political party you support, and you'll discover that people think the media is too tough on whatever party they happen to support.
We have another question here. How do you evaluate or measure the public's understanding and by extension, adoption of public health directives? Also, I'm just noticing we only have 4 minutes left. So if anyone would like to respond to this question, please jump in.
We've been doing polling and we've been doing engagement exercises online with individuals, inviting people to a dialogue about the different public health measures and to let us know what are the barriers to wearing masks, what do you think about wearing masks, and we've actually used that information then to in turn communicate about mask use. The polls showed again that rise in mask use that you had on your presentation, Carey. The other thing is also on the ground. So we have community developers out in neighborhoods, and that's why I mentioned I think there's more to be done with multilingual approaches and more direct communication with more diverse populations, because we are seeing that not all of the messaging is coming through and making sense to everybody.
Would anyone else like to respond to that question? We have another question here. If most media consumers want news for free, how do they imagine a consequent media ecosystem collapse, and how will it ultimately impact their lives? Admittedly, a difficult question to answer in the span of, now we've got 3 minutes left, but.
Okay, I'll do it in about a minute and a half. Most people have no idea where news comes from and have no idea how much news costs. They see it around them. They think it's always going to be there. They don't realize that news organizations may go out of business. April Lindgren at Ryerson has been doing a lot of work with other people on what gets called news deserts, which are in Canada and also in other countries as well, where local news outlets are shutting down. On jsource.ca, you can find lots of the maps of showing all that. It's a little bit like Joni Mitchell, and you don't know what you've got till it's gone. And I'm afraid people are going to discover that that's true. There's an interesting story in the New York Times this week that's worth looking at about, it appears to be conservative interests moving into communities where where media has collapsed and creating quasi-media that looks like media, but is really actually public relations or promotions for certain interests. We'll see some of that. But the problem, part of the big challenge is the public. And frankly, in Canada, some of the issue is as well as the public broadcaster gives it away for free. And as long as the public broadcaster gives it away for free, that's another issue against the private broadcasters as well, against the private media community too, which is probably an issue that needs to be sorted out by government in terms of determining what it thinks its role for the public broadcaster should be. But public really knows, as our survey demonstrated, the public doesn't understand there's a problem and they have no idea where news comes from. Or most particularly, they have no idea what it costs to gather it.
Okay, thank you, Chris. So I'd like to thank our panelists once again for their presentations and for participating in this discussion. I'd also like to thank Brent Jolly from the Canadian Association of Journalists and John McGillis from Carleton University for their help and support on this panel today.
Thank you, everyone.
Thanks so much.
Thank you.
Thanks very much.
Yeah.
And thanks everyone who tuned into this panel or watched it later.